My name is Matt Rose. I'm a physician, also entrepreneur. I founded a company called Sava that actually came out of the first blockchain and healthcare hackathon in the United States back at Distributed Health in 2016. So all of you in attendance, I know where you're sitting. I was there several years ago, and so I'm really looking forward to all the amazing things that are going to come out of your brains over the next few weeks. A little bit about my background is in terms of medicine, I do peri-op care at the moment. Prior to peri-op care, I was really focused on obstetrics and gynecology and had been involved in sort of a transition of different subspecialties, really around surgery. But surgery, psychiatry, and general medicine, a little bit of exposure in there. So when it comes to things, though, coming back from the time that I first wrote for the ONC NIST back in 2016, one of those first 75 papers on healthcare and blockchain technology, how we can create interoperability across the United States. There's been a whole transition, and I've been fortunate enough to be part of the scene since we were able to talk about maybe some of you might recall that Dilbert cartoon where it says, "What color do I make my blockchain?" Right? I'm sure that resonates with some people. And so at the time when people say, "I want to apply blockchain to everything," and really what it comes down to, and the thing that I want to stress the most is that it's about the use case. It's not about the technology, right? Blockchain is a tool. We're using it to help solve this problem, which is stopping COVID-19. And it's really a matter of leveraging, the expertise of everybody that's here, all these mentors, whatever I can contribute from my experience as well, to help you understand what is the problem that we're trying to solve with technology. That the user experience is a big issue for me as well, or a big component that I try and strive for. We use MetaMask in Ethereum all the time, but trying to give a private key for a patient to use really is a bit of a challenge. So there's multiple layers here. When it comes to how we're going to structure things, how we're going to attack this problem as a group, what are the different components you're going to use, and what is the use case that you're going to attack it from. In all fairness, a patient doesn't need to know that it's blockchain technology, but we, who are this technical community, might know that and might realize the benefits that it can bring to realizing how we can create better data management, better supply chain management, better things that are around the challenges that are coming about. Telehealth was brought up earlier. What can we do together? And so I'm just here as a resource for everybody to leverage and to support you all in this project. Feel free to reach out to me about anything, various backgrounds in cybersecurity, healthcare, and I also was involved in clinical research and translational medicine for a little over 9 years.